Okay, so I'm assuming not many of you have heard of the Association of Ambulance Chief Executives, which is why I've put our logo up there. And I am a paramedic by trade, and I've also done extended ambulance practitioner training. And there's a lot of terminology out there. There are paramedics that, on 1st of April, paramedics can now prescribe once they've done the relevant training, so the profession's moving forward significantly. Just a little bit about the organisation. We are the central body with the voice of ambulance services. We're supporting development, and that's why we've been supportive of the ReSPECT process. So I've been involved for the last 2 or 3 years, however long we've been doing this project. So it's been really useful to see its development and see where we've got to, and share with you today some of the aspects of ambulance service that you may not have considered. So the ambulance services are a 10 English ambulance NHS trust. We've also got membership from the devolved administrations, and on the map there you can see the 10 English trusts, so you can see the map anywhere broadly where they are. There used to be 32 ambulance services in England, but quite a few years ago now we reshaped and we've configured to 10. And just to give you an idea of the data, we received in 2016 to 17 11.2 million 999 calls. So look what ReSPECT is called. It's called, got the word emergency in it. And when people ring 999, it should be for that sort of life-threatening emergency. That's a lot of calls, and I'd like to see in the future a lot of them patients having a ReSPECT form. We don't take everybody to hospital, and that's really important. There is a public perception, you know, we just scoop and run and everybody goes to hospital. That is really, really changing. And we commonly describe that the types of 999 calls that we receive are only around 10% are truly immediately life-threatening, and we call the other 90%, we put them in this pot of urgent care. So as you're probably aware, we've done significant advances in care about the life-saving stuff, the cardiac, the stroke, the major trauma, and all reconfigurations that have happened. And there's a lot of work gone into ambulance response time. So it's about saving lives, getting there quickly. But the 90% of patients that fall into this urgent care category, that's where we're changing and advancing our roles of paramedics into the arena of prescribing. And the terminology is still a little bit tricky out there, but a paramedic is a band 6 clinician, registered profession. But we are developing advanced and specialist roles, and paramedics are now expanding. I'm sure you've seen in your local areas. We've gone into GP surgeries, walk-in centres, EDs, and actually we've lost a lot of paramedics that we've trained, and we're a bit short at the moment. So we're advancing the role of paramedic into much more complex clinical decision-making, assessment, and that's where ReSPECT fits really, in terms of us having to assess a patient and decide what is right for them. And obviously the emphasis is care closer to home. If the patient wants to remain at home, we're a big part of that process. The revised ambulance response model is, as you can see there, it's not just about sending the ambulance and sending them to hospital. We've got significant investment in enhanced call triage and what we call the hear and treat. So that's having discussions with the patient over the phone or carer before we send the ambulance. If the ambulance goes, we'll talk about the see and treat, the see and refer, which is perhaps managing the patient differently, not taking them to hospital, or discharging the patient with a care plan, or even advising on self-care. So there's quite a breadth to what we do. When I work clinically 1 day a week, this is a typical patient. Very common to go to an elderly person with long-term conditions, degrees of frailty, end of life, palliative issues, etc. But I think what you need to be aware of, we are moving into a much more electronic digital world, but when I practice, and I practice in Yorkshire Ambulance Service, I do not know anything about this patient that's from 999. I walk in a house, I'm completely blind to everything. So I will ask questions such as, do you have a DNR form? But I'd like to be able to ask, and the patient's aware, do you have a ReSPECT form? Obviously, there are limitations to the fact that you've got to find the bit of paper with it on. But my last clinical practice last week was 2 patients in care homes, and neither of them had a DNR form or a care plan. They both had to be taken to hospital for various reasons. But this is what happens when you ring 999. If you ring 999 and say they're not breathing very well or they've stopped breathing, we will, unless we've received further documentation or a record, clinical record, we will predominantly be in the zone of life-saving and therefore doing the CPR, the defibrillator, the ambulance. That's where we geared up and we do save lots of lives. But we've got to just really think about, is this right for the patient, what they want, do they have a ReSPECT form? So when I wanted to put this slide in just to mention that particularly the care home patients, and I really think this is where ReSPECT should really be gain some momentum. As I said, the patients I went to last week didn't have any advanced care plans. And my dad's in a care home, and I hope he doesn't leave that care home unless he's died and passed away in the care home. So care homes are a really bigger area for us to focus on, and we do get lots of calls to care homes, particularly when the care planning or things are a bit panicky at 3 a.m. when the manager's not around, and those ReSPECT forms are going to be crucial if they're completed correctly for care home patients. So I've spoken to colleagues. I've got a couple of colleagues here today who are end-of-life leads, amongst other things, in ambulance services. So your average ambulance service might not have a dedicated end-of-life person. But my message is don't forget to engage with your ambulance service. And that does include the emergency side, the non-emergency transport, and there are a lot of private providers out there to consider as well. So make sure your ambulance colleagues are linked in with your networks, if not already. If you're going to, I know what happened in Hull and East Riding. They launched on the 1st of April, so they started to liaise with us in Yorkshire Ambulance Service months and months and months before. They held an engagement day, ambulance colleagues were invited, which was brilliant. And they've done a constant trickle of information, and we've backed onto that with information and communication to our ambulance clinicians. So, a bit about it's coming, this is what you need to know about it. So that continuous trickle of information to the D-Day or the actual day of launch. So again, the message about ensuring care home and GP involvement. I'm not sure whether we've got many GPs here today. Good. We've got a few hands showing up, so that's fantastic. Because I think that's, again, the community of health professionals that we've really got to engage with. Again, just the tips I think are important about when you're talking about the ReSPECT form, and we've influenced this in the development of ReSPECT, is on the form there's a little bit to think about. Does the person want to stay at home? Under what circumstances might they need to go to hospital, or when do they want to stay at home? And this is so helpful for us, and this really, really will manage patients that want to stay at home in a much better way. Because we will scoop them off to hospital quite commonly unless there's information to say otherwise. And there's that conflict. The patient sometimes wants to stay at home. The relatives have reached that panic point. Whatever plans have been put in place, things happen quicker, sooner, and we reach that level of panic and distress that everything goes to the wind, whatever planning, as we're all aware, and they ring an ambulance. And there we are with our green suits, marched into the house with all the defibrillators, and actually we need to stop and think, is that the right thing to do? So if it's documented on the form, have a think about what you're documenting, and would that work for an ambulance clinician? If we're faced with the patient and the ReSPECT form, is it going to do what we need to do to make our decisions? So consider what circumstances 999 might have to be called when you're thinking about the discussions. Will it be available? Is it being buried in the pile of newspapers and magazines and clutter in an average person's house, including mine? And the other thing, if we are going to manage patients at home that are ill, that have run 999 and do have a long-term health problem, and maybe quite ill, near the end of life even, we can't just leave them and walk out. We need to be able to refer them to community carers, community teams, and access appropriate pathways. So the contacts bit on the form needs to be up to date, and please be around when it's 3 a.m, because a lot of people go home at 5, and there we are at 3 a.m, ringing contacts, ringing people and they're all closed, gone home, and we can't get hold of anybody to refer that patient to. And if the medicines are required, obviously have a think about the just-in-case medicines. I think that's it. Thank you.